Today on Home Care Heroes, we learn about a program that pays your agency and your caregivers for getting people in your community to get COVID shots. It's a program for 12 states, but even if you're not in one of those 12 states, you could sign up essentially as a community organizer and participate. Enjoy.
Welcome to the Home Care Heroes podcast, featuring trending topics and practical wisdom for success in home care. Here's your host, Ken Accardi.
All right, well, welcome to today's episode of Home Care Heroes. I have a very special guest today by the name of Burgess Harrison, and Burgess is the director of the National Minority Health Association. Did I get that right?
Yes, National Minority Health Association Executive Director, correct.
Perfect. All right, and we're actually going to talk about a different topic today, and what that is that currently the National Minority Health Association has a program working with home care agencies that essentially is to help get some of our elderly and shut-in folks to get their COVID vaccines. What it does is it ends up, compensating both the agency and the caregiver for doing this service and helping, achieve herd immunity and all that kind of thing. So let me take a break there and say, welcome, Burgess Harrison. Thanks for being on the program.
Well, glad to be here. Thank you for the invite.
All right. And I want to give a little background of Burgess. So I've been told by a friend of mine who's a long time, home care industry veteran, that he and Burgess in the 1990s were talking about, how could we possibly get caregivers to, record their time, and that Burgess came up with the idea. He says, well, you should use the universal communication method that, people use. And the other person's like, well, what does that mean? And he says, well, the telephone, we should put together a way that caregivers can do their clock-ins and clock-outs using the telephone. And actually it was there that the whole idea of telephony was born, and prototyped by Burgess and this other individual. So Burgess is, doing what he's doing now, which is really fantastic, but he really has strong roots in the home care industry and as an innovator and that sort of thing. But hey, let me just, turn it over to you to tell us more. I kind of gave the introduction that the whole idea is to try to get folks to get their vaccines, but yeah, tell us a little bit more about the program.
Thanks, Ken. So everybody knows COVID is been a challenge for the last 18 months. There was a feeling that it was kind of licked. Excuse me for that. There was a feeling that was kind of licked, but not really. And now we're going through the fourth wave, the Delta variant, and so forth. With COVID, a number of things began to come to light. One of them is that it has impacted underserved and minority communities much harder than the population at large. And this is evidenced in terms of higher rates of folks getting the virus, higher death rates, and so on. At the same time, there is a higher level of hesitancy about the vaccine within minority communities for a number of reasons. One being a study that was done a number of years ago at the Tuskegee Institute, where people weren't told they were being studied. So you have these different forces at work, and then you add in social determinants of health. If from a testing or vaccination program, large scale program is put in place and it runs from 9 to 5. Well, a lot of minority community members, work and do either shift work or aren't able to make those kinds of hours to get either tested or the vaccine, or they, have other impediments. They can't take off an hour from work because that hour really has a significant impact from a financial perspective in their home economics, their budgets. So, and those are just a few small things. When you look at the impact of COVID, again, in minority communities, you have, and home care workers in particular, fit the profile from a government perspective, where you have folks who may live in more multi-generational congregant situations, So you have a lot more people in smaller areas, take public transportation, lower wages, and the list goes on. So COVID brought all of these things to light. So the government put out a grant and wanted to get some innovative ideas of how you could approach the addressing hesitancy within these minority and underserved communities. So we got a notice about the grant. It was early in May, and we got 2 weeks in order to write a grant and get it in. So we came up with a concept and put it together in 2 weeks. And lo and behold, in June, it got accepted. And so, it's one of these things, careful what you wish for, because you might get it. So, but it's been really, literally not even drinking from a fire hose. It's almost like the ocean, because there are so many things that need to be done when you're working within a government structure, if you will, to be able to launch and stand up something like this, because none of what we're doing existed before we began to turn up the program. We had to build a new type of database that you registered workers, agencies, and community members. We have to verify that vaccines were delivered. We have to report information. The government wants a 29-question survey completed by workers, and I think it's like 13 questions by community members. So that information has to be captured and passed on, all of it done in a secure manner. So a lot of piece parts that had to be put together in a very, very, very short time frame. So even though, the grant, we were notified mid-June, really didn't get started till July 1st, because there's a whole bunch of things that you have to do. So we had, 30 days, 6 weeks in terms of putting all this together, as well as, we're working with a number of different partners. We have Dr. Ian Smith, who is our medical spokesperson, TV personality. We have Gather Voices, which is our video engagement platform where people who participate in the program can leave video messages that can be exchanged. We're working with Navan, which is a company that has that provides home health care education. I don't know if they like this analogy, but it's a little like Netflix for home health, where an agency would pay, I believe it's like a flat rate per month, and has access to all kinds of healthcare information. But they had some information on COVID, and we thought it was important that if we're trying to get home health workers to talk about COVID, that be sure that they have some good information. So we're taking information from Dr. Smith and information from Navan and their COVID training and providing that to folks. We have a marketing PR partner that really worked with us to develop the entire concept, the branding, the messaging, everything relative to the platform, the social media. That's Sage Growth Partners. And they work with people like the American Hospital Association. And so they have a really good understanding of healthcare. So we brought together a whole group of people, these folks, to help us in developing this. And then our back end developers, Mithrick Studios, and they do they've done a yeoman's job from a data perspective. So all of that to say that we put this together. We launched in a soft launch in mid-August, and we have over 300 agencies that are involved. And the program is very simple. Well, we believe it's simple, and that is where an agency signs up, and then they encourage their workers to sign up. There's no charge or anything like that, no cost to the agency or workers or anybody like that. So they encourage the workers to sign up and register online through our portal. And then they get mobilized to then go out and talk to people to get vaccinated. First thing though is, and it's a challenge, but I think you've all heard about healthcare workers not being vaccinated, and that's a challenge. And home care is not, and home health is not immune to that. So one of the first orders of business is, hey, we got to get home care workers vaccinated, because you have patients who are saying, hey, don't send somebody to my house that's not vaccinated. On the other side, you have states that are imposing mandates coming up in September and October that healthcare workers have to be vaccinated. So you have a program now that will incent people to get vaccinated, and what it works out to be is that the community member gets $25 a shot, and we did it that way, a shot, because you could get either the Pfizer or Moderna, which are 2 shots, or Johnson & Johnson, which is 1 shot. And we're not trying to take a stand as to which is better or not better, because that's not really the point. So we just made it $25 a shot that goes to the community member. The worker also gets $25 a shot for bringing that person, and when I say bringing, not physically bringing, but introducing, persuading, helping that community member make the decision to get the vaccine. And then the agency also gets $25 a shot. And we did that because, one, the worker has to take this survey, which takes about 15 minutes, so it takes a little bit of time. They're going to be taking a little time out of their day to talk about the program and working with people to get them vaccinated. And we needed the agencies to be on board, to be supportive of the project, so that, they didn't stand in the way. So it's this 3-tiered program and process for people to get vaccinated and get rewarded.
Okay, let me jump in on you there for a minute. So just kind of focusing on, if I'm an agency and I'm just hearing about this and I'm not signed up yet, it sounds like, it's a way for me to get engaged in the community, for my caregivers to get more engaged, to help people get vaccinated, and to make a little bit of money in the process. So you mentioned that, of course, at the outset that, COVID has disproportionately affected underrepresented minorities for a lot of different reasons and that sort of thing. Is this program restricted to individuals who are, of minority groups? Okay.
It's not restricted. We are targeting, and part of the grant was we were targeting particular areas and states, but it is not restricted. Anybody who comes to our portal, through the process, gets registered, will be eligible for the program. But our mandate is to focus in states, and that's on our website, and in underserved communities. So that's what we're trying to do. But the bottom line is getting shots in the arms.
Okay, got it. Yeah. So we, as we know, like at ANCODA, we have a lot of customers that are Medicaid basically providing home care services through Medicaid. Some of the big cities like St. Louis or Kansas City, or or parts of Virginia, or whatever the case may be. But they would all be eligible for this, and they might really be in some of the communities where this could really make an impact and make a difference.
We have no age limit except for whatever is for the vaccine.
Yeah.
And anyone in any community can participate. Again, we have a target area, target areas that we're focusing on, but again, the bottom line is we got to get people vaccinated, because that's the reason why the Delta variant is alive and kicking, if you will.
Yep.
And causing the problems that it is. If we had more people vaccinated, it would have choked off the spread of that variant, but we didn't. So here's where we are, and we're now going back into winter. I hate to even say those words, but it's a reality. In addition, now you have the whole booster shot situation coming into the mix. We do not provide rewards for booster shots. It may be something down the road, but at this point in time, it's just for the 1 or 2 initial shots.
Okay, got it. Okay, so really, any home care agency can apply there, and they can have their caregivers apply, and and anyone who's eligible to get a COVID shot, who they can persuade and get them signed up and get them vaccinated, is eligible for the shot and for the reimbursement and all this. So that sounds really, really powerful and positive. Go ahead.
It's the agencies in the 12 states. If they are multi-state agency, then they can, in those other states, they are certainly welcome. Because the way the grant was set up, they have 10 in our particular scope of the grant. They had 10 awardees, and they sort of took the country and split it up into different areas. So who are doing different kinds of things.
Okay, got it.
So like we're doing. So if it's in the 12 states, if you go to our website, it'll go through all the states. There's Texas and California, Florida, and there, New York, for example. Missouri is in there, North and South Carolina. So so those are the states that we're focusing on and looking for agencies in. We have over 300 that have now signed up. And when I talk about 300 agencies, we have people like Addis, Accent Care are in the mix. So we have some very large organizations, Alera, have signed up to participate in the program. So we think we've got a wide scope, a wide reach from states and workers and so on as we roll the program out.
Yeah, fantastic. So some of the mentions or the names you just mentioned, are they like actually the software vendors like Access Care and Alaya?
Accent Care.
Accent Care. Okay, so it is. I mean, everybody has to be a provider. It's not like
right. These are right. It's
perfect.
It's providers. So we have in terms of software providers, we would like them to participate in terms of they don't get rewarded, but in terms of talking about it to their clients would be great.
Fantastic.
Yeah, at some point in time where and who knows where this may go. So we think it's important for software providers to have an understanding of this and support it, because there is a data collection aspect to what's going on. The government really needs to understand as much as possible so that effective tools can be developed for for vaccines and for the deployment of vaccines in an appropriate, effective, and efficient manner. So.
Yeah, so I'm actually on your website right now, and I guess I already have 6 of the states. So Texas, California, New York, Missouri, North Carolina, South Carolina. I'm trying to see where would I check for the other ones, just so I can make sure that I have a comprehensive list here.
It should be, I can't tell you off the top.
Is it under my shot, or?
We can, well, no, go to flexforchecks.com.
Oh, Flex for Checks, got it.
Right.
Perfect. And
then that is the site. So flexforchecks.com or .org, but flexforchecks.com is where you want to go. Excuse me.
No problem.
And all of the information is there in order for people to sign up. So the main focus is on agencies, workers, and community members. But if there are software providers, they can just reach out and contact us. We had an earlier pre-launch site up where we had the ability for pharmacies and software providers. We're going to put that back up, but our initial focus was to get out for agencies, community members, and workers to get them registered. So,
okay, that sounds really good. All right, so just trying to, we don't have to make this a real long podcast. And by the way, I mean, we do, of course, our marketing, and we have different companies that we reach out to, and we're going to try to make them all aware of this. But it would be good to let them know if their states are, could be part of this program or not. So I'll make sure to get the rest of that story. I guess, I'm just kind of curious. You explained, I mean, how hard it is to get a program like this off the ground and in short order. And I certainly can relate to that, running and launching a business that quickly and all that type of thing. But, if you take a step back, do you have any nice success stories or anything that you could share so far, or nice, any just good stories from the community or individuals that maybe received a shot that wouldn't have otherwise?
Yeah, well, good question. This morning, it's funny you mentioned that. So this morning, one of the folks we're working with, Thelma Washington out of Florida, and she came on. We actually recorded her, and she does these events. Part of what her scope is a school that she leads, and she was really thinking, I want to be sure that my student bodies are protected, because what happens in schools, one kid gets it and then it goes to other kids, things just spread. So her thinking, what can I do? So obviously getting people shots. So she participated in our program, and she has now led about 230 people to get shots through what she's been doing herself. And when I say herself, I mean, she has people and things like that. But she has kind of spearheaded the movement. But she told this really quick story, and I am not going to do it justice because it's her telling it, which is really powerful. But I'll try to do the best I can. She had one of her parents who was hesitant about getting the vaccine. That parent had 7 kids, and so Thelma said to that parent, and I don't know what the parent's name is. He said, whatever, XYZ, listen, you've got to get the vaccine because if you get COVID and you die, I can only handle 2 of your 7 kids.
Okay.
And the other ones will have to go like in foster care or whatever. But, that is a real conversation. That's real talk. That's reality that has to be dealt with as we're talking about this, not this theory or anything like that. That conversation really is part of the crux of what we're talking about. So there are folks who don't want to get the vaccine, and it's because it's my body, it's my decision, but you step back and say, gee, what if we did that with smallpox and polio? My goodness, where would we be, if anywhere, if that same kind of thinking was prevalent at that point in time? So it's, if you aren't doing it about yourself, the point being is do it for someone else, because although, and one of the things that people are getting misunderstood is that because you have the vaccine doesn't mean that you're not going to get COVID. It has never been talked about in those ways. What has been said is that if you do get COVID, your degree and impact on you will be lessened, and a higher probability that you will not go to the hospital. And if you look at the cases, it's borne out. The people that are in the hospital are unvaccinated. As the CDC says, we have it's like an epidemic of the unvaccinated that's taking place right now. So, and yes, will you have a death or 2 that occurs from within the vaccinated population? Sure. No one said that this was 100% either. But again, you're going to see most deaths are going to come from the unvaccinated population. So, again, do this for other people. And it's interesting when you look at the whole vaccine arguments, or people who don't want to get vaccinated because they don't want to put anything in their bodies that or whatever that they don't know about. But it's like, really, because people are putting all kinds of things in your body, smokers and drinkers. Okay. Yeah. For as 2 very simple examples, people who get tattoos, the idea you're taking in, not that it's not, I know it's regulated, but really, you're getting tattooed. Somebody's putting ink,
needles in ink into your arm or whatever the case may be.
Exactly. You can kind of go down the list of things that people do, and at the same time they're saying, well, I don't want to go get the vaccine because of XYZ reason. It really just doesn't make any logical sense. So and when it has shown the effectiveness and the speed that they were able to develop it, and they're using technology that's been over 10 to 20, we were refined over 10 to 20 years. What was sped up was a regulatory process, paperwork, things that duplicative things that really did not touch the quality, safety, efficacy of the vaccine at all. They were all things that were in the periphery. So we're just trying to get that message out, trying to debunk the myths that are out there, because it seems like there's a new myth every week, something different that's going on.
Yeah, it's tough. Just to share a personal story. I mean, I unfortunately, I was vaccinated in April when my age group became eligible to get vaccinated, but I actually did contract the Delta variant myself, and that was discovered in like the last week of July. But as a vaccinated person, I just had a stuffy nose for a number of days, and I had a positive test, and I stayed in containment for 10 days, and and now I'm totally fine and that kind of thing. So I think that it is borne out that if you do have the vaccine, it's going to be more of a mild thing for most people. And sadly, I have a friend who college roommate whose brother literally got COVID around the same day I did, and 17 days later he was gone. And, and this is a highly educated person who worked in, science and technology. And he was, one of these folks who said, well, I'm going to wait for the FDA approval and all these types of things. And, unfortunately, I mean, this is a pretty tough virus here. So, I mean, it really does come down to, trying to get yourself vaccinated. So I'm blessed that I did have that vaccine and that kind of thing. So I think everything that you're doing is super important. And I really appreciate you sharing with us today. So just to kind of, wrap it, I think you've explained the program really, really well. And I'll make sure to get up on, everywhere that you read the podcast. I'll make sure that we know what states are eligible, or I guess I'm not going to say where you read the podcast, but where you listen on your Apple Podcasts and things like that. I'll put that in the show notes, and we'll have a YouTube video of this as well. And I'll make sure to have that in the notes of the states that are eligible for the program, and we'll try to communicate it as best possible. But Burgess, tell us one more time, how do people get in touch with either the vaccine program specifically, which is the Flex for Checks, as well as the THE and the National Minority Health Association? How do they get in touch with both of those entities?
Absolutely. Well, for Flex for Checks, the website is Flex for Checks, so FLEX.com. So that's the way to go there, and there's a way to contact us through that for the Flex for Checks program. The National Minority Health Association, our organization website is TheNMHA.org, and there's also a way to get through backdoor through to Flex for Checks from there as well. But that's our organization website. And we have a number of different, this is one program of several that we have. We have a dementia program that we're launching for caregivers. And we have an Operation Healthy You, which uses a patient activation measure as an underlining part of the program, and a number of other things that are coming down the pipe. So I think people will be very intrigued as to our approach, which is science-based. And one of the things people should recognize from a science perspective is that it evolves. And if you think back to all the things that were said, I know people talked about masks, for example, it was said, don't wear it, then wear it, and so on. And want to point to that as an example of, science having a problem. It evolves. It's enlightenment that takes place. And I just use the example for, way back in the day, scientists thought the world was flat. Obviously, now we know that that's not the case. Things evolve. We learn new things. Science is about consensus, and that consensus will change over time as new information is available to be able to be analyzed and critiqued. So science is not perfect, but you got to start someplace, and you got to put a stake in the ground. And so the things that we're doing are all science-based, and we want to educate the public, minority communities, and others. So please, hopefully the audience will go to flexforchecks.com. If you're in one of those states as an agency, sign up, or a caregiver in one of those states, or community member, you can just go on your own and get it done. It doesn't have to be through an agency. So we urge people to do that.
All right, fantastic. And thank you for all that. And I think if you'll be up for it, we'll invite you again, and we'll talk about dementia programs and other ways of, using the patient activation measure to make things better for folks along the way. But thanks again, Burgess Harrison, for being our guest today on Home Care Heroes.
Thank you. Thanks, Ken.
Thanks for joining us today on the Home Care Heroes podcast. Home Care Heroes is produced by Ancoda, the software for the heroes of home care. You can listen to back episodes by visiting forhomecareheroes.com. That's the number 4, then the words homecareheroes.com.